It may not always be easy to talk to doctors, nurses, or other health professionals, but it will help both you and your loved one with dementia if you can ask the right questions at the right time.
When the time comes that caregivers and even the individual who's been diagnosed with dementia needs to go in to speak to a physician, I think it's important to think ahead of time what questions you're going to have, what you need to know. Write them down. It's really hard to remember that because there's so much information going back and forth. Also, maybe take a family member with you so that there's two sets of ears hearing everything. So what one person misses, the other person will be able to pick up. And book a long appointment. When you call the clinic, tell them, this is a really difficult conversation and I need extra time. Tell the physician when you enter the room, we're having a hard time with this and I just need some extra time.
There's a whole variety of reasons I think that caregivers have trouble talking to physicians. One thing that gets in the way is often people think that they may not have the right to talk about their spouse with dementia.
I guess what I run into a lot is people feel that there's a betrayal somehow of the person if they're engaging with healthcare providers. So talking to the person that has the illness and saying, I want to be here for you, I want to support you. It's really important for me that you know that I'm going to be talking with these people and sharing information with you. So sometimes getting consent from the person themselves. Speaking to the healthcare providers is not a betrayal of the person because you are their helper, you are their care provider, and you need to be able to share information freely in order to provide the best possible care for that person.
In a relationship, when it's a sibling, the doctors are rather loath to discuss that person. So how I arrived at that was I said to my sister, do you know, Nancy, if anything happened to me and you phone the doctor and he says, oh, I'm sorry, I can't discuss that. I'm going to go and we're going to get that form where the doctor will release the information to you if anything happens to me. She said, that's a good idea. So we did that. Then she said, maybe I should do that with my doctor. I said, right on, kid. So we went to her doctor and we got the same form filled that she gave me permission for the doctor to tell me about her. Husband and wife, it's not a problem. But siblings, you have to get that permission from the doctors. And it opens up the lines of communication. And that's what I think is so important.
A lot of caregivers have told me they have a notebook that they keep so that every time they talk to a person, they write down the name and role of that person and their contact information and maybe a few notes about what that person can help them with.
It's just crucially important to connect and find out what's available to you. Right from the day programs to the in-home help, even strategies for your family. There's all kinds of people in the community who know how to do this and that you don't have to do it by yourself.
All the different backup that I had was absolutely tremendous, and I really enjoyed having them, and they were just wonderful people. And so I could plan a bit of my life, and in hindsight I wish that I had done that actually a couple or 3 months before I got on.
You probably have a doctor, a specialist, you might have somebody at the Alzheimer's Society, you might have a nurse practitioner involved or a seniors nurse. There's just so many people that could be involved.
Sometimes having a communication book so that people who are coming in and out of that environment, because the caregiver might not always be there, is just instructing people who are coming into the home, please, while you're here, make a note of who you are and what you were doing and how things were.
My best advice to families trying to navigate this system that sometimes feels like it's only roadblocks is to find someone you trust most in that, someone you feel like you can communicate with the best, and lay out your questions in front of that person on a regular basis and see if they can act as a liaison for you with the other healthcare services.
In terms of coordination of the care, the caregiver is absolutely pivotal, and that's a lot on their shoulders, and I think that's increasingly recognized, but their role as manager, part-time nurse, part-time warden, there's a lot of different hats that person has to wear, and they require a lot of support for that as well.
That is so important that you have a good relationship with your physician who understands what you're going through and what the patient is going through. And having the doctor work with you and not say, well, you just have to do this, or you just have to rely on somebody else, or whatever.
You as the caregiver need to be directing what is necessary for you and what's necessary for your spouse and what is going to work. Ask and tell and expect.
What I found with the doctors and that you have to be quite demanding, and you have to state your case, and you have to tell the professionals that you're in charge, not them. And you have to have a conversation, and eventually they do come around. I mean, these are smart people. So they do eventually see that, yes, okay, we're going to let this guy go along with his plan.
Care coordination involves planning your loved one's care and support and sharing information with everyone who has a role in it. This allows for the safest, most appropriate, and most effective care plan.
When caregivers know what to expect, when they're well prepared, well linked into resources, they do so much better. There's less stress involved, you know what's coming, you know when to ask for help, and you know where help is. Like, I think the biggest fear of a lot of caregivers is what's going to happen when I can't do this anymore, what's going to happen to my loved one. And we can help them with that.
There's no, absolute right or wrong. You're just doing the best you can as you go. And it can be so important to just feel like you have other people on your team with you to help you, either if you're the person with dementia or if you're a caregiver. So having a sense of pulling together a team of people that you feel can be helpful to you and supportive of you, and not being too hard on yourself when things don't go exactly the way you thought they were going to go, because invariably you're learning as you go.
I think one of the things that we were really clear about is function and what he was able to do, and what's been lost. So he was able to do this, now he's not doing this, now we're seeing that he's doing this. And for me, it was knowing if that was significant. Should we be doing anything about that? Dad can't comb his hair anymore. Is that something we should worry about? He doesn't, he doesn't seem to be able to tell time. Is that something we should worry about? Because I wasn't familiar with what you medicate along the way and what you worry about.
I would really recommend just be honest. Be honest with how you're feeling, how you're doing, what your biggest fears are, what your questions are. And it doesn't matter if it doesn't sound like other people's questions, because in that moment, that appointment is about your family and your loved one with dementia.
One of the huge struggles is being able to ask for help. Going through the journey of a caregiver for somebody who's living with dementia can be very difficult, and it's not something that most people can do alone. So you need help from family members, friends, basically the community as a whole. Many caregivers want to do it themselves, and that in itself, I think, just takes a real toll on people.
You're dealing with it as best you can. You try and get the help in that you've got, but it's always, they can't do it as well as I can. Oh, it's going to be too hard for them to do, or too hard for them to deal with him. So I always have to maybe oversee everything, and therefore I'm not getting the care that I need at the time.
Part of our job as well is to know that it's not just the patient we're checking in with every time we meet our patients, but we will be checking in with the caregivers, we will be checking in with the loved ones, and to accept that from us as well.
You just have to reach out, and they will do their best that they can for you. And don't be scared to take it. They worked with me right away when I reached out to them and said, I need help. And I have a great support group that I go to once a month. That's for me. I've tried to get support for Cecil, and they've offered me respite. He can have 5 weeks of respite in a care home, and he won't take it yet. he feels he doesn't need it, he can look after himself. So I just keep rebooking.
It's really, really hard to work at the same time as you're caring for someone. So, you know, I can't recommend enough the in-home support and those kinds of things to help you out. And it's also helpful if there's more than one child. You know, you could put a schedule together with other siblings that really, really helps take the pressure off one person and allows them to not just care for the person who's been affected, but also continue to share and grow their relationship with that person as it changes.
At some point along the dementia journey, you might need to reassess how or even whether you can manage to care for your loved one at home.
The physical, getting her to bed at night, getting her up at 3 o'clock in the morning when she would call me to go to the bathroom. And then, of course, eventually that got worse. So it was changing and doing the physical stuff. And it was then that my youngest daughter said, "Dad, it's time you became a husband again and not a caregiver." And those were very important words to me.
It's hard to see the man that you've been with for over 50 years be taken away from you, not in death, but be taken away from your care and handed over to somebody else. That's the struggle I have right now. And I try not to dwell on it too much. I try and only think of today and tomorrow. What next week brings, I don't know. What next month brings, I don't know. So I try and, again, pull it all together. Don't think too far in advance and just concentrate on the now. Hopefully I'll recognize the time when it comes that if he is a danger to me or himself, then he'll have to go into residential care.
There are times, people will understand this when they're involved in this, there are times of lucidity. Times when she is just so there, and I know it's real. And on occasion, in those moments, I take the opportunity to ask her really what she really wants. I had input from her brother suggesting that she is being socially deprived and that a care home would be a much more stimulating place for her. And it's not that I haven't thought of this many times. We have discussed it quite frequently, and in those moments of lucidity, she tells me no, that she wants to stay where she is. So the kicker is, what about me? And that's where we're coming to a place now where whether or not I am able to carry on much longer with the setup that we've got. And there's a practical side of that. So far, so good. But we can see some behaviors that are starting to shift.
I remember getting a phone call, and it was from the care facility, and they said that they had a place and a room for my husband. That day was the end of my world. That was the day, oh, he's fine, he's going away, he's going into a care facility. That was devastating that day. But as time went by, I saw those angels and what they did for my husband. The care that he got was immaculate. The friendship, the activities, it was wonderful. 7 years later, when he passed, it was a relief. It was a relief. And it was a different feeling. It was, oh, he's at the 19th hole in the golf course.